Hi, social work peeps. Welcome back to social work exam prep, where I finally get to wear my glasses. I turned the ring light off. It was blinding with my glasses. You also couldn't see my eyes, so can't see someone's eyes. They're probably lying. Anyway, we're going to get into it. Today's question is a clinical assessing question. I actually really like clinical assessing questions. It causes you to really have to think about how some of the theoretic models that we like to focus on, as well as the actual treatment models that we use, how they align and overlap and interweave. My hands got weird, but here we go. Your client tells you that he can't stand it anymore, but doesn't believe that he can make the needed changes in his life. He engages with you in discussions about what his life would look like without his problem behaviors. Your client is most likely at which stage of change? A, contemplation. B, pre-contemplation. Oof. Let's try that again. B, pre-contemplation. C, preparation. Or D, maintenance. The correct answer is A, contemplation. So when it comes to behavior change, oftentimes you're going to go through stages between when you make a change from start to finish. This can actually be seen in almost any example when you are making a change, but most probably known ones are going to be big changes. We'll take health behaviors, for example. When you are making any kind of change, there are several stages that you're going to go through. Pre-contemplation is first. So you are either totally unaware, you don't give a shit, or you're just not ready to make whatever that change is. Whatever it is, you're not there yet. Someone told you you should, and you're like, I'ma wait. The next stage is contemplation. That is when you care, right? You're now caring, you're aware, and you agree, but you're not quite in the you're not quite in the stage of actually making the changes. You're thinking about it, but you're at least on board with, I need to make a change, but I don't know how, or I don't know if I can. That's generally where you're at when you're in contemplation. You are contemplating what that stage will look like, and if you were to do the things that you should probably be doing to make that behavior change, what that would look like. The next stage is preparation. Now you're not only on board, but you're starting to make preemptive changes. So let me explain that. When you are looking to starting to prepare, if you are planning to, this is a very basic change, make a change in shoe type, your preparation would be that you start saving money and looking online for shoes that you might need to get, right? So maybe you have to start wearing a specific kind of orthopedic shoe. You're gonna start looking into that now that you are on board with the fact that you may need to wear an orthopedic shoe to improve whatever you have going on that shoe can help fix. Then, maintenance is when you are doing the damn thing. All right, you are doing it, you are living your life, and you are just maintaining that new change. Anytime someone makes a behavior change, it not only has to be their decision to make the change, but they have to be all the way on board. And yes, when you are going through any of these stages of change, you can go back and forth, back and forth. So you could start at pre-contemplation, get to contemplation, and then go back to pre-contemplation. You don't just move through them linearly. They are fluid, and some people do go backwards and forwards for quite a bit before they make it to maintenance. And even when you get to maintenance, you could fall off the wagon and be back at contemplation or pre-contemplation, depending on how far back you go and depending on what happened. Oftentimes what I see in behavior change, when somebody goes back, there's usually some kind of life event or, life lifed, and that caused them to fall off the wagon with whatever they were doing and choose something different. And then usually when they are out of whatever was causing that negative life event to help change their behavior, when they are grounded and ready to jump back on the wagon, that's usually when they are in contemplation. They're usually in pre-contemplation when they've fallen off the wagon and they're doing whatever the hell they want for whatever reason. It doesn't necessarily mean that they're doing it on purpose or intentional or to derail themselves from whatever health behavior or whatever change they had that they enjoyed doing. These things just sometimes happen. I work in weight loss and weight management, and a lot of this is a big part of making some of the lifestyle changes that they have to go through in order to be successful on the other side, whether the other side be that they had weight loss surgery or the other side be that they are taking a weight loss medication. They do have to go with some sort of lifestyle change from potentially what they're doing, in addition to this new tool of the medications and or the surgery. A lot of this comes in, especially preoperatively, or if I'm having a consult with one of the non-surgical patients, we, the behavioral health specialists, check and see what stage of change they are in. That is oftentimes what I am looking into. Once I know what stage of change they're in and where they'd like to go, we work on small goals to help them get from where they are to what their larger end goal is, and we just chip away at it until we get them to that goal and they're at maintenance where they would like to be. Oftentimes, patients who are coming into the clinic are usually already at contemplation because they're now at the appointment. They recognize that something's going on, but they're not sure how to make the change or what exactly they should be doing. And so that's where the guidance from the whole team comes in. But most of the time they're at contemplation. Before they've made the appointment to come to the clinic to see any of us, they're in pre-contemplation. Once we start making the changes, for example, I had a patient who was drinking 2-3 liters of soda a day. Took him a minute to get on board with drinking something other than soda and help with managing some of the symptoms that they were dealing with in terms of their diabetes and their weight. Took quite a bit of time because this patient was in contemplation. Like, knew something was up, even knew what was up. Still chose to say, I don't know that I'm there yet. And a lot of the times, the biggest thing that you can do to help some of your patients when you're going through these stages of change is meet them where they are. If they are not ready yet, do not push them. They'll be further away, like in another country further mentally. So don't push. If they're not there yet, work on something they are ready to do and just make note of that and come back to it. Some of the stages of change in terms of theoretical models that I love, and these were ones that I used that I studied in my doctorate degree program. So I'm a big fan of behavior modification, especially when it comes to lifestyle. Big fan of lifestyle medicine. Health belief model, big one. That was a part of my research project for my doctorate. Big one. You want to know it. Transtheoretical stages of change, also a big deal. Most of these are a part of the transtheoretical stages of change in terms of that model. I think because this is something that is so important, especially with how to help people with substance use, how to help people with some of the negative behaviors that they are going through, as well as for people who might be any of my social work peeps that are medical social workers who are trying to stay in that, especially with now there being such an integrative model of trying to have multiple disciplines under one roof within a specialty to be able to help the patient through everything that they need. I think that knowing this is going to be important. So my plan is to make a separate video explaining these models and potentially some others, but definitely in another video I'll work on behavior change models and explaining some of those in more detail. Well, as always, it was good to chat with you. It's good to see you through glasses. I hate contacts. And I hope you all come back. Again, this is social work exam prep. Tell anybody that might be preparing for an exam in mental health in general, right? These might be social work related questions, but a lot of them are clinical. So anybody taking the exam for their LPC, LMFT, psychology, some of this could still be something that you need to know. or at least some of the test prep skills that I'm trying to teach can be something that might help you when you take your test. So, tell your friends, tell your mama, whoever, bring them on over. Thanks so much for coming by. See you next question.